The Mental Health and Addictions Information System, better known as MHAIS, is the first clinical dataset available in HRDP-SK. MHAIS contains demographic, administrative, clinical, and service-specific data for every client seen in any Saskatchewan Health Authority outpatient mental health clinic from 2017 to present. In 2024, there are 13 Saskatchewan Health Authority outpatient mental health clinics in the province. Data from these clinics is collected to ensure continuity of care for clients receiving mental health and addiction services within Saskatchewan. By connecting coordinated information on these services, providers are better able to maximize the consistency of care throughout Saskatchewan. Providing care to the individual is what is known as a primary use of data. Data used for research, analysis, or health system planning is known as secondary data. Through inclusion in HRDP-SK, MHAIS can be used for secondary data applications like research. Let's take a closer look at the types of data you can find in MHAIS. There's demographic data, which, as in all our datasets, is de-identified and masked to prevent any individual being identifiable. Demographic data includes information like age at time of service, gender, and self-identified gender, as well as information about patients' living arrangements and location. Administrative data provides information about the visit type and location of services. Finally, there is clinical data, which provides relevant health information about the individual's service. These data are what makes MHAIS unique in HRDP Saskatchewan datasets. To understand all the variables included in the MHAIS database, please visit our data dictionary, which is linked in the video description. Today, we will talk about some of the important variables available in this database for researchers. Presenting issue. The patient's presenting issue is recorded as a category. For example, this could be coded as an anxiety behavior or substance issue, with additional variables for diagnostic rank and date. Locus and calocus. Several variables address the locus or calocus score used for assessing level of care. Locus or calocus is a standard decision support tool to assist in matching offering services by determining the best treatment plan and services for the client. To learn more about locus and calocus scoring, researchers can refer to resources from Deerfield Solutions at deerfieldsolutions.com/locus-calocus. Addiction tracker. Detailed addictions information is included in MHAIS. This covers 17 classes of drug and route of administration, as well as variables describing treatment history, length, and intensity of use. Researchers may use the data in MHAIS to answer a number of different research questions. For example, an investigator could look at the seasonal variation in the number of depression-related healthcare interactions. They could describe the patterns of mental health comorbidities in presenting patients. This data could also be linked with other data sets within HRDP Saskatchewan. For example, the prescriptions database could be used to identify drugs used in the treatment of particular presenting issues. Researchers may also wish to use this dataset in interjurisdictional projects. Related datasets in Canada include BC's Mental Health Database, the Manitoba Mental Health Information Database / Mental Health Management Information Systems, and the Ontario Mental Health Reporting System. The HDRN Dash portal is a great place to start multi-jurisdictional inquiries to use MHAIS in conjunction with these datasets. Researchers do need to take care when requesting and interpreting data in MHAIS. The information in the platform has evolved over time. MHAIS replaced 3 previous reporting systems used in the province: Sunrise Clinical Manager, Mental Health Information System, and ADG. Data from these previous databases are not found in MHAIS. MHAIS data starts in 2017, but not all data in MHAIS came online at the same time. The first health regions to use MHAIS start reporting in May 2017, with subsequent waves of reporting regions coming online up to 2024. Additionally, different categories of data came online at different times. The Provincial Suicide Protocol was released in October 2021. Provincial service matching expectations were released in October 2022, and presenting issues were standardized in October 2022. The use of locus and calocus scores was mandated for entry to service provincially in October 2022. Provincial pre-intake management was launched in April 2023, and provincial wait times reporting began in April 2023. Finally, there may be some site-specific modifications to MHAIS and variability in data between sites. Data quality and standards weren't standardized across sites until 2022, so caution should be taken when comparing data in different years or at different sites. MHAIS provides a powerful new tool for researchers to understand mental health and addictions in Saskatchewan. To learn more about the data in MHAIS, visit the HRDP website or contact our Data Access Request team at hrdp-sk@usask.ca.